All right. Good morning, everyone. My name is Bradley Peterson. I'm the Executive Director of the Coalition of Greater Minnesota Cities, and very glad that you could join us this morning for a webinar on the work that was done on EMS during the most recent legislative session, and a little bit about our involvement. So, for starters, we'll go through a little bit of what today's agenda is. We're going to give you a little bit of background and context on why did the CGMC get involved, and about the lobbying strategy. We're going to talk about the various EMS proposals at the legislature. And then most importantly, and I think what everybody's probably most interested in, is we'll go through and talk a little bit about what was in the final bill, both in terms of the structural reforms to the EMSRB, some of the pilot programs that are included in there, impact on EMS personnel, and then finally talk about the emergency one-time aid program. How much, who's eligible, important dates for you to keep an eye on, eligible expenses and reporting requirements. And then we'll talk a little bit about at least what we think the outlook and the next steps for the 2025 session are, because of course this is not an issue that is going to go away, nor is it in any way solved. There's still lots of work to be done. And then we'll take some questions at the end from folks as they have them. And as a reminder, if you do have questions, please use the Q&A function in Zoom to ask your questions. And then we will triage those at the end and go through as many as we can. And then also, too, we'll be giving you our individual contact information if you have other follow-up. First, a little bit about the Coalition of Greater Minnesota Cities and who we are. I know we've got a lot of our current members and a number of other entities and organizations that are EMS related, as well as a number of other cities that are not members. So welcome all again. We're very glad that you could join us. The CGMC represents more than 100 cities outside of the 7-county metro area. And we typically work on issues related to local government aid and property taxes, environment and energy, economic development, transportation, annexation and land use, and labor and employment. So you're probably wondering, why did we get involved in the EMS discussion? I think one of the things that we've been able to do over the years is be nimble, and that when there are new issues that are of interest to our members, we've been able to jump in, learn about them, and represent the greater Minnesota City perspective. And so we heard from a number of our members starting about a year and a half ago regarding legislation that they were concerned about regarding the primary service area law. And that really started off our engagement, which grew pretty rapidly and pretty quickly and pretty deeply in the EMS issue. At this point, I'm going to hand it off to my colleague, Eric Simonson, who did a lot of the legwork and individual lobbying on this issue. And so with that, I'll give it to Eric.
Thank you, Bradley, and good morning, everyone. Eric Simonson. I am a lobbyist here at Flaherty and Hood, and in this case, representing, along with Bradley, the Coalition of Greater Minnesota Cities. Appreciate all of you taking the time to attend. We're going to go through a number of things as Bradley kind of laid out in the agenda here. And a lot of it is pretty detailed, and I understand that, but I also think that everyone that's on this call probably has a vested interest in what this bill looks like, how it came together, and probably more importantly, what some of the next steps are going forward. So I'm just going to kind of jump right in here, and I'm just going to give you a couple of notes before we get started. I'm often going to refer to the EMSRB as it exists today in current law, with the full understanding that the name is going to change and the position is going to change here over the next several months. But so if I talk about the EMSRB, I'm just kind of generally talking about that particular organization / office. And then the last thing that I want to just highlight before I get too deep is that a lot of the data that I'll share with you is really based on, A, data that we've gotten from the EMSRB, or B, data that we've kind of compiled internally based on a number of the inputs that we know, at least as of today. So I'm not suggesting that everything here is going to be exact and precise, but we think it's about as close as we can get given the data inputs that we have, at least right now. So as Bradley mentioned, the CGMC is really a member-driven organization. And when our member cities come to us and say, look, there's a problem here that we should be thinking about, we should be concerned about, perhaps we should be involved in, it's an opportunity for us to kind of dive in. I have the benefit of having some history, work experience in the public safety field, a number of years. So at the very least, that when I go and talk about some of these things, I have at least some history and experience and knowledge of what we're talking about. But at the same time, it's been a pretty eye-opening experience for a lot of us in terms of really demonstrating how serious and significant the problem is, especially when it comes to kind of underfunding of our EMS providers across the state. So this is a slide that we used in a number of settings as we kind of walk through this process leading up to session, as well as going through the legislative session itself. And it really is meant to kind of highlight the staggering problem when it comes to the reimbursements and how flat they've been staying over a number of years. And I'm not telling you anything that you don't know, but keep in mind that when we set out on this initiative at the beginning of session, going in and asking legislators for a large amount of money to shore up our EMS providers, we had to really kind of start from ground zero with a lot of them and explain to them how the problem kind of came to be, where it's at, and what exactly the root cause of this problem is. So this slide is simply exactly that. And it just kind of shows folks that don't have an in-depth working knowledge of the industry, what the actual problem is. Okay, this slide, I think, does a couple of things. On the right-hand side, you kind of see this pie chart. And to Bradley's point, this is why groups like the Coalition of Greater Minnesota Cities kind of got involved in this. More than half of the license out there are held by some local unit of government, generally going to be a city, but also includes some townships, counties, tribal governments as well. But certainly more than half of them are held by some local unit of government. And as the problem kind of continues to escalate, our local units of government were being asked to subsidize these operations outside the borders of their own cities, which has kind of been the root cause of this problem for them. And then on the left-hand side, these are kind of the numbers that we used to come up with the $120 million that we originally asked for from the legislature. I can't tell you how many times I heard, well, the $120 million is just kind of pulled out of thin air, and that's not exactly true. It basically takes the total insurance revenues reported in 2022 and then factors in not only the total operational expenses statewide, but also includes the value of the annual capital cost and the value of the volunteer labor subsidy, which we know is huge, especially in rural Minnesota. If you do that math, you're going to come up with a number that's roughly about $120 million. And that's kind of what prompted us to ask for emergency operating aid for 2024 in the number of $120 million. So we didn't just come up with this plan or idea out of thin air. I have to tell you that served 8 years in the legislature, another 4 years now lobbying. I've spent more time on this bill than I think any bill that I've ever put any amount of time into during that period of time. And it was fun work. I thoroughly enjoyed it, and I enjoyed getting to know a lot of new people, different people. But we wanted to make sure that we were taking the message from the people on the ground doing the work to the Capitol in terms of getting that message out there. So if you just kind of look at the very left-hand side here, this is the MEDS task force that was convened by the League of Minnesota Cities. They continue to meet. There's a number of organizations represented on that group. They're doing a lot of deep dive into different policy issues and trying to kind of figure out, what can be done going forward that can not only improve the industry, but hopefully come up with ideas that could reduce costs as well. And the CGMC has a seat on that task force as well. Internally, we created our own EMS working group. I think Bradley mentioned that we have over 100 member cities, probably 35 or so, maybe closer to 40 of those members hold an actual ambulance license. So we drew from that group to kind of put together a working group to try to figure out what our steps would be going forward. What was important to them? What could we do? What could the legislature do to help resolve some of these troubles? That all happened, about a year ago during the summer and very early fall. We went into our annual fall conference with some ideas and some requests from the membership. And they kind of supported the concept that we do have to put some work into this issue. We created a list of principles, which we'll talk about here in a minute, but generally received approval of the coalition to kind of move forward with this as a legislative initiative. About the same time, I think maybe late in the fall, maybe even December, the legislature, House and Senate together created a legislative task force with the specific purpose of going out into Minnesota and trying to figure out from their perspective what some of the challenges were that ambulance services were facing. That group initially met in St. Paul for their initial meeting. Made up of 5 members of the Senate, 5 members of the House, bipartisan group. And then they went on a series of road trips, I think Mountain Iron, Elbow Lake, Mankato, and I think the last one was down near Winona. And we attended or listened to each one of those hearings, and the overwhelming message by 100 miles was that the problem lies with reimbursement, recruitment, and retention, right? And we told legislators, if you remember 3 things in terms of what the problem is, it's reimbursement, recruitment, and retention. We heard that over and over and over again from folks that came out to these meetings, testified before this legislative committee, and we felt really good about having a consistent message with what they were hearing just prior up to the legislative session starting. And then we as a coalition held a number of regional forums as well, just trying to get the same message, hear from different groups of people that we don't normally hear from. So we had some of those in rural Minnesota. And again, the message was very clear, very loud. The biggest problem that folks are having is just kind of this lack of reimbursement and trying to figure out ways to keep their organization moving forward. So from that came our proposed solution. So this just gives you a sense of, kind of how our internal process works. Last fall in November at our annual fall conference, the coalition did approve these principles, which kind of becomes our guiding document, if you will, as we move into the lobbying season. And these are the kind of the 5 things that the coalition would like to see happen or would like to see us work on. And of course, the first one is this short-term funding from the state to the struggling license holders across the state of Minnesota. At the time, we were thinking 130 million. Obviously, as you know, the bill that we introduced with Senator Hochschild and Representative Lislagard was 120 million, but it really highlights the fact that there is a critical emergency need to get cash out the door to some of these folks. We get the question now and then about, well, why didn't we just move forward with a kind of a long-term solution right out of the gate? And the answer is we didn't have time. That takes a little bit of work and a lot of coalition building to try to pull something like that together. And we'll talk about that when we talk about our goals for 2025. But we felt that in the short session that was coming forward in 2024, given the fact that there was monies available, this would be a reasonable ask from the legislature. And then, of course, you can look through this at your leisure, but we certainly will continue to support medium range and long range state and federal funding to support these licenses. Anything that we can do to make these operations easier to operate in greater Minnesota, that's kind of the focus that we have with this particular group. and create a framework for proposed amendments to the PSA law. I think Bradley mentioned that was one of the things that really got us involved in this, was kind of the quote unquote bill that was introduced that would have really turned the PSA law on its head, which we did not support. We felt like that was a little drastic. And as we move forward here through subsequent sessions, we want to be paying attention to what those changes are, and make sure that they're not to the detriment of our rural members. So that kind of gives you an idea of how our process works and what the principles were that were created. So from that, we kind of proposed a three-phase approach here. In the phase one, which we've kind of just moved through with the 2024 legislative session, was this passage of $120 million, an appropriation to help keep services operating. Obviously, we didn't hit the 120, and we'll talk about what that number is here in a minute. But we did, I think, do a couple of things. I don't think anyone that's paying attention can deny that there's significant momentum in place right now around resolving this problem. And I think that's a really good thing. It sets us up well going into 2025. And the second thing is that while we did secure some funding, it's certainly not enough, not what we would have liked. It will hopefully help some of these folks keep the doors open until we can get to a more sustainable solution. Our phase two is kind of supporting reforms that benefit rural services, making sure that local governments have a seat at the table where the decisions are being made. We'll talk about that here when we get into the bill. And then some kind of sustainable funding mechanism to offset these Medicare, Medicaid shortfalls. I'm not going to sit here and tell you that, we can just wait around for the federal government to do the right thing and make these things whole. We all know, you all know better than us, that you've been waiting for that for a long, long time. And it doesn't make any sense for us to sit around and wait for that to happen. We've got to put something in place now. We can't wait. And then kind of our long-term phase three is to continue to advocate for those higher reimbursements. Sensible reforms, of course, always make sense if they're good for public safety, if they're good for patient care, if they're good for the license holder, then let's do them. If they make sense, let's do them. And that gives you an idea what kind of our proposed solutions would be. As we kind of stepped into the legislative session in February, one of the things that we wanted to do was, as of course, as you can imagine, as a lobbying organization, you're going to spend a lot of time meeting with individual legislators, which we did. But trying to condense all of this data and all of this information into a small package that you can cover in the short period of time that you get to spend with folks can be challenging. But this is essentially the base document, what we would call a one-pager that we used to kind of share with everybody, that kind of really outlines what the problem is, why it's important, what our ask is, and what our commitment is. And our commitment is pretty simple. We're asking for a large amount of money in 2024, keep the doors open, keep things operating. But our commitment is to come back in 2025 with a reasonable, sustainable, long-term solution. And then the flip side is what I'm really kind of excited about through this entire process, is that we built a large coalition of supporters around this concept. Now, I don't know that all of these folks would support the final version of the bill, and a lot of that is out of our control, but it really reflects kind of across the broad spectrum of folks that are involved in EMS, whether they be local units of government or associations of various professionals, individual cities. It kind of reflects a group of over 40 people, 40 organizations that came together to support this document. And this really resonates, at least with rank and file legislators. So that was very helpful. So there was a number of proposals at the legislature. I'll just cover them real briefly. We have the Senator Hochschild, Representative Liz Lagarde bill. This was the bill that the coalition and all of those supporters that we just talked about were standing behind. Would have provided $120 million in emergency aid out the door. It was one-time money from the state general fund, so kind of the leftover surplus, if you will. The bill was written in such a way that it would have been administered by the Department of Revenue instead of the EMSRB. Although the department would have been required, of course, to coordinate with the EMSRB because the EMSRB is kind of the holder of the data, at least the data that's available. We built in some accountabilities into the bill, and of course, report back requirements. And this kind of became the bill that we were lobbying over the course of a number of months through the entire session. And a number of you folks on this call were involved in that effort. And I can't thank you enough for your help doing that. There was a couple of other bills too that were related and kind of became factors as we got to the end of the session. Senator Seeberger and Representative Hewitt, of course, are the co-chairs of the legislative task force that was put together to kind of look at EMS issues. Both have a background in EMS, so have some working knowledge of how that works. But their bill was really a complete overhaul of the EMSRB as we know it today in current law. It would have changed from a really what we would call a strong board with an executive director to more of an advisory board with no real authority and a very strong director. It creates 3 new advisory boards with defined memberships, and we'll talk about that a little bit later. And it creates a new director position that has a lot of authority, who would be appointed by the governor and confirmed by the Senate, much like any other commissioner. And there was also a provision in there that these 2 authors were very passionate about creating a sprint medic pilot program funded at $6 million. With the idea being that this could be implemented over a short period of time somewhere in greater Minnesota, with the idea that we collect some data from that work, bring it back to the legislature here in a couple of years and see if it worked, how well it worked, what some of the challenges were, is it an effective tool going forward, et cetera. And then lastly, Senator Rasmussen put together a bill and introduced it, and eventually Representative Backer did sign on to this bill, which was kind of an alternative emergency aid bill, much like the Hochschild-Lislegard bill. It also appropriated the $120 million, but the formula about the aid distribution was significantly different. If you looked at the Hochschild-Lislegard bill, that was designed to provide aid based on losses that were reported to the EMSRB in 2022. The Rasmussen-Backer bill basically created a formula within the bill itself based on primarily the size of the PSA and what the call density of the PSA was. The bill essentially excluded most of the metro area license holders and most license holders with multiple licenses. Now, the nice thing about the Rasmussen-Backer bill is that you could run the formula and determine who exactly was going to be eligible and approximately how much aid they might be entitled to, depending on the amount of money that was appropriated. So as we went through this entire process, these were kind of the 3 bills, if you will, that were moving together. And eventually at the end of the session did get combined together in some fashion. Some of our other legislative dynamics really kind of set the stage for how the session played out. Of course, as you all know, Governor Walz came out with a supplemental budget early in session and kind of included some money in there for EMS. He included the $6 million for a pilot program that we just talked about, but he only included $10 million for emergency aid. And it was only going to very specific regions. It wasn't kind of a all across greater Minnesota distribution. It was primarily to 2 individual EMS regions, Northeast and I guess what we would call West Central or Central, whichever it is, West Central, I think it is. But only $10 million. And the problem is once the governor comes out and says a number, it's pretty hard to change that number with respect to what the leadership eventually agrees to. So eventually Senate and House leadership did agree to budget targets and signed on to that. And that included this 10 million plus the 6 million for EMS as a whole, but only 10 million for emergency aid. So once that happened, that made our job incredibly difficult. Because then you not only have to sell the concept of why this investment is so important and necessary, you also have to sell them on the concept that you actually do have more money to spend. It's just a matter is if you choose to do it or not. And then, of course, we have the general acrimony of the session itself. It's a non-budget year, of course, so there's really nothing that has to get done. So there's, scenarios that play through your mind as you're going through the session where this whole thing just falls apart and absolutely nothing gets passed. It's an election year for the entire House of Representatives, so that always plays a factor in the second year of the biennium. We have the arrest and charging of Senator Mitchell, which really kind of turned the flavor, if you will, of the Senate floor for the rest of the session. And then we just kind of have this general lack of cooperation between the caucuses on bonding, which does impact the general flow of the session. So let's jump into the bill itself and talk about just kind of the final outcome here. And I'm trying to keep on track here time-wise. So there's a number of things in this bill, and it's House File 4738 was the final bill. And I know Emma's including links to these things in the chat as we go through, but I would encourage you, if you're involved in this issue at all, is to kind of read this bill a couple of times. Granted, it's 50, 60 pages, something like that, but and there's a lot of material in it, but it's worth a read, especially when you get into some of the personnel pieces. But we're going to kind of cover it at a real high level here. So the bill itself does definitely change the EMSRB as we know it today. And it's going to replace that board with an Office of Emergency Medical Services. That change, that transition will come on January 1st of 2025. So just, 6-7 months from now. And it'll be led by a director that's appointed by the governor, much like a commissioner position. That initial appointment will happen in October 24, according to the bill, and would allow then that person to have a few months to kind of ramp up and prepare for this January 1st transition period. Once January 1st hits, then that appointment would become quote unquote official and be subject to Senate approval. Within this office, there are 3 subdivisions, each which would have their own deputy director. And we have the Medical Services Division, Ambulance Services Division, and of course the EMS Providers Division. And you can kind of see how those are all broken out in terms of what those responsibilities are. If you just look at it from a kind of an organizational perspective, you can see that there are things within here that probably will be good for the industry. With the idea that, kind of the way this is broken down might actually allow us to do some really good things, I think, that will come out of that office. I think there's going to be some concern, and anytime that you have change, there's going to be some concern. But hopefully, the right person gets appointed as the director and we can move forward working collaboratively. And then, of course, the board itself, which currently has a fair amount of power, would be replaced with these 3 advisory councils. And they just kind of align with each one of these 3 areas we talked about with the deputy director. The EMS Advisory Council, wide range of stakeholders. We didn't, as a CGMC, we really didn't dig too deep into this particular bill. But once we identified that it was moving and was probably going to be part of the final package, we were pretty insistent that we have some local government representation on this advisory council. So the bill itself calls for 2 local government members, one from the Metro that would be appointed by the League of Minnesota Cities, and one from Greater Minnesota, which would be appointed by our organization. And there's a EMS Physician Advisory Council, and then a Labor and EMS Providers Advisory Council as well. So all of those will have to get ramped up and start their work after the first of the year as well. So whoever ends up in this position is going to have a lot of work to do in the final quarter of the year. Within the final bill, there is also this Sprint Medic pilot program. And now that it's in there and it's passed and it's funded and it's moving forward, I think it's in everybody's best interest to see that it's implemented appropriately and correctly, and then let's see what data comes out of it. Let's just see how it works, see what happens. I know there was a lot of angst about, why are we spending $6 million on this when we could invest the $6 million into, other things that really could make a difference. Whatever the case may be, here's what we have. I say we move forward and let's see what happens and see what we get out of it. But essentially, the Sprint Medic, and most of you on this call already know what this is and how it works. It'll be authorized and regulated by the new director of the Office of EMS. The bill calls out 3 specific counties: Otter Tail, St. Louis, and Grant counties. And the funding and the program would run through June 2027. So how this process will work, just kind of looking at the bill language, and then it'll be refined, I'm sure, by the director. PSA's primary ambulance services in the 3 counties could apply to participate. And we'll presume that the director of the office will kind of put together a process and figure out how that will work. And then it requires, obviously medical director oversight, and then a lot of evaluations of outcomes would be important too. So all of that will be collected and held by the new director of the Office of EMS. There's a number of impacts to EMS personnel, and I think some of these things are good. And some of these things came out of concerns that were raised by different providers across the state in terms of, getting back to that whole recruitment and retention piece. So there's some changes in here, and I'm not going to pretend to be an expert in any of these things. I would suggest that, as you have questions about some of these personnel issues, contact Dylan Ferguson, the executive director of the current EMSRB, and we're going to give you some contact information for him as at the end here. But I think that, he would be the expert that I would rely on to interpret the language in this bill and really provide answers to our providers in terms of how it impacts EMS personnel and ambulance staffing. But essentially, it allows some certain types of certified personnel to staff ambulances without the passage of the paramedic skills test. RNs who are licensed EMTs, RNs who are certified flight nurses, PAs who are licensed EMTs, things like that. So I'm kind of excited to see what comes out of Dylan and his shop in terms of what the actual structure of this might look like. It also changes the minimum BLS ambulance staffing level, which is something that's been talked about for a long time. It requires that at least one individual who is an EMT, an RN, or a PA, as we just talked about above here, and then one individual that could drive the ambulance who either meets all of those requirements or is a registered EMR driver. And I think that might be a game changer for some of our really rural providers, and hopefully to the good, but we'll see what happens there. I think there's some opportunities there to really make some improvements to patient care and patient outcomes when we talk about that. And of course, there's similar changes to the ALS staffing requirements. And then lastly, I would say pay attention to this, and you're really going to probably want to dig into this because there's some changes to the EMR education program where they must be approved and they must align with the national requirements. I think that is going to be a handful. There's a lot of work that could be done just in that particular line by itself. And I'm very interested to see what becomes of that and how that plays out. As you know, rural Minnesota especially depends a lot on EMRs today, and we'll see what happens in terms of these training requirements. And then there's some kind of what I would call one-time opportunities to reinstate some expired licenses. So if you've got a license that expired more than 4 years ago, but less than 10, there's some opportunities for folks to get those licenses reinstated without having to retake an entire course again. And it does include a recommendation from the medical director, of course, but you still have to take the required training, but not the entire course, and then whatever the board approves for an application form. So I think the idea is that if there's folks out there that maybe want to get back into it and be helpful to their community, perhaps this is an opportunity, opens them a window. We will see what happens there. And that'll, of course, apply to EMTs, medics, and community paramedics as well. So get into the thing that we really started this whole initiative off with, and this is this one-time aid program. Again, it's $24 million just for the aid. It's not the 120 we wanted, but it is what it is. This was a hard fight just to get to this number. And if you think about the 24 plus the 6 for the Sprint Medic, that's $30 million. That's $14 million more than the governor recommended. So I think on any given day, I would tell you that $24 million for a brand new program being stood up is a win in any book. But it's a little hard to swallow when we all know that there was more monies that could have been invested here. And it's a little tough, but nonetheless, we'll take it and we'll cross our fingers in hopes that it actually does some good. But there's some eligibility points. I just want to talk about some of this quick. You must have possessed a license in 2022. And you have to continue to operate under that same license here in 2024. There will be an application that's required to be submitted to the Department of Revenue, and you'll have to copy the EMSRB director, and that due date will be September 16th, 2024. Now, we're highlighting it here. I am confident that you're going to hear more information about that, both from the Department of Revenue, probably from the EMSRB, associations like the MAA. All of these groups are going to be pushing this date out there to make sure that folks that are eligible get their applications in before the deadline. But it's coming up in September, so you got a few months to be thinking about it. We don't even know what the application looks like, but we're hopeful that it'll be relatively simple and not be a week's worth of paperwork. Who's excluded from eligibility under the bill? Specialized life support services, that was kind of the idea from the beginning of this entire endeavor. Holders of multiple licenses, with the exception of Essentia, North, and Centricare. These three, their greater Minnesota license areas would be included as eligible. And the majority of the license holders in the 7-county metro area would be excluded from eligibility. So the aid calculation, and again, going back, what happened here at the end was we took the Hochschild-Lislegard bill and the Rasmussen-Backer bill and the Seeberger-Hewitt bill and kind of blended this all together. And we ended up with a formula, if you will, that will account for the aid calculations and the distribution out to the eligible applicants. So there's 3 calculations that go into the final number. The first one is 20% of the appropriation right off the top is divided equally between all the eligible aid applicants. Now, we have shared kind of what I would call a financial run. Keep in mind that run is assuming some things. It assumes that every service that's out there that's eligible would apply, right? Now, there's circumstances, I suppose, where some that would be eligible under the bill would not apply, which would increase the amount of aid going to the other applicants. But the first calculation is pretty simple math calculation. It's just 20% of that $24 million divided equally amongst everyone that's eligible. The next one is based, or the next 2 really are kind of based on pushing more funding out to larger licensees, larger geographic areas for licensees that have a relatively low EMS response volume. So the next 40% of the 24 million is divided based on your PSA square mileage. And again, going back to what I said in the beginning, a lot of the data that we have here is going to be from what the EMSRB has on file. So I would suspect that as you go through this application process, you want to make sure that what your PSA square mileage to be actually aligns with the data that the EMSRB has. Just want to make sure of that. And again, this particular 40% would favor services with a geographically larger service area. And then the last 40% is divided out based on the EMS response volume. And it really favors lower volume providers. There's a point system that's built into the bill. I didn't put the point system on the slide because it's a little wonky in terms of policy. But it's a decent way to figure out how we get the most amount of money to where it's needed the most. And we make some assumptions that, the larger your run volume is, the more opportunity that you have to generate some revenue. So it's kind of based out in 3 tranches here, and then it comes together at the end. And the document that I think Emma would be sharing in the chat as we went through here, would be kind of based on everyone that's eligible would apply. and then divide it out that way using this particular formula. So you get a sense of what the final number might be. Now that final number may vary, right? We'll see what happens when we get to the end here, but it should give you at least a ballpark figure. Question comes up, how can we use the aid? And we made it as, basic as we could. Operational expenses, capital expenses, both of which are defined in the definitions of the bill itself. And operational really covers everything from soup to nuts, whether it's personnel, operating supplies, fuel, et cetera, insurance, whatever. All of those operational expenses would be eligible uses for these aid dollars. Your capital expenses, whatever if you're bonding for an ambulance or you've got other capital expenses that kind of go above that $5,000 threshold, that would be eligible. And it also says that all funds must be used only within Minnesota. There are at least one that I can think of off the top of my head, license holder that's headquartered outside of Minnesota. Well, there's two, I guess, that I can think of. But the point is that they can only spend these funds on their portion of a PSA that's located within Minnesota itself. So we don't want to be subsidizing operations in South Dakota or Wisconsin. Some important dates for you to know. We talked about the September 16th application date. Again, this is going to be critical. You just got to make sure you get that application into the Department of Revenue and the EMSRB. If you don't get that in, it's going to be really hard to get anybody worked into this process. And you don't want to turn down free money. December 26, 2024, this is when the certified aid amounts must be paid to providers. That particular date happens to align really nicely with local government aid payments that go out from the Department of Revenue. Since they're going to be issuing these checks, it made sense to align with that date. So hopefully, at this point in time, by the end of 2024, you'll have a sense of what's coming and about when it will come. December 31st, 2025. So roughly a year later, any amounts that are not spent or encumbered by this date must be returned to the DOR. So if your aid is, $140,000 and you haven't spent or encumbered by the end of the year 2025, in theory, that money goes back to the Department of Revenue and is returned to the general fund. But we want to leave enough time there. That's a good year. We think that anybody that's doing this business will probably have ways to spend it very quickly. It shouldn't be a problem. And we included the encumbered language so that in the event that you ordered a piece of equipment or something that was out there on order, hadn't been delivered yet, maybe you haven't actually paid for it yet, but you've committed, you've encumbered those funds, that should be also eligible. And then looking into 2026, reports by each aid recipient will be due back to the EMSRB. By that point in time, it won't be the EMSRB anymore, but you get the idea. The state wants to know how much aid you got, how much aid you actually spent. Hopefully those numbers match, what that aid was used for, and supporting documentations for all of that. This will be critically important to make sure that the aid program is administered appropriately, that the aid that was appropriated, the public funds, were used in such a way that aligned with the original intent of the bill, and to make sure that legislators have some comfort level that this thing was administered well, and the funds were used and were definitely needed. So those are the dates that you should just pay attention to. And again, I am confident that you're going to get all kinds of notifications over time in terms of what to do and when to do it. So that's pretty simple. I've been talking for a long time, and I appreciate everybody paying attention and listening. There's a lot of data here, and we just wanted to make sure that we had an opportunity to kind of present it in a way that hopefully made some sense. And as we go forward, there are ways to keep in touch. The coalition's not letting go of this particular issue, for sure, on the funding side. There's ways for you to kind of just subscribe to our CGMC EMS mailing list. And then, of course, you can reach out to us with any questions that you have. My name, email, phone number, that's my cell phone number right there. Emma Nelson, who is kind of a key player behind the scenes here at our office. You can reach out to us at any time with any question. If we don't know the answer, we probably know who does, and we can get you pointed in the right direction. So next steps. And of course, your questions, as Bradley talked about here early on, keep those coming, and don't feel like when we sign off here that we're done, but your questions can come at any time. And I just want to talk a little bit about next steps, and I'm going to turn it back to Bradley here real quick. But as I said before, when we presented this idea to the legislature starting in January and February, we made a commitment that this was like the first step, right? This is phase one. And we fully understand and recognize that it's upon us to come back with a sustainable, reasonable, long-term solution that will keep our ambulance operators going in greater Minnesota for the foreseeable future. We would love to see the federal government step in and do the right thing here and take care of this problem. But in the absence of that, we feel it's absolutely critical that the state does that because rural Minnesota is hurting. All of you that are doing this work out in greater Minnesota recognize and understand that, and we appreciate your help. But we have more work to do, and we have to figure out how to do that. So going forward, you'll be hearing more and more from us, I think, as time goes by. And I'm just going to jump to the next slide here, which has more contacts and information, and I'm going to turn it back to Bradley.
All right. Thank you, Eric. So like Eric said, this is really not the end of the process. We're really kind of at the beginning, I think, of a lot of exciting things. So initially, let's see here. First question that we've got is from Eric Jonason. How did Essentia St. Mary's qualify for aid? They are a hospital residing within the PSA that Mayo holds. And how did Metro or North Metro qualify for aid? So Eric, maybe if you want to talk a little bit about maybe some of the choices that were made by the legislature and kind of how that evolved.
Sure. Thanks, Bradley. And Eric, that's a great question. If you go back to the beginning when we started this, we really tried to look at this from a statewide perspective and just said, okay, who is out there that holds ambulance license? And we know that there's like 260 of them out there. And who needs the aid? And decisions are made by individual legislators and groups of legislators. And ultimately, the final bill that was passed really focuses in on not just greater Minnesota, but certain parts of greater Minnesota. So the bill actually excludes, license holders that touch Rochester, Duluth, St. Cloud, and Cato, and includes those Essentia, North, and Centricare primary service areas that are really located in greater Minnesota. So when we say Essentia is eligible for aid, only in those license PSAs that are outside of city of Duluth, because we know Mayo has that one, right? But the ones that are truly in greater Minnesota, rural Minnesota, those would become eligible for aid. North is the same way. North's Metro license is not included as an eligible aid recipient, but the PSAs that they have out in rural Minnesota are. And this is just kind of the fact of how these things come together. And there's a lot of interests, and we're trying to meet obviously the needs of cities in greater Minnesota, but our partners that we worked with that were very helpful, they made a compelling point that some of these rural hospital providers could stand to get some emergency aid as well. So that's how it kind of came together. Mayo is excluded, Sanford is excluded. We really only included the rural areas that are covered by Essentia, Centricare, and North Memorial.
All right. Other questions from the Q&A? Let's see here. It looks like from Monty Frank. I hope I pronounced that correctly. How does the 11 tribal nations apply for the aid that reside within PS areas of other EMS agencies?
Another good question. So there's six tribes in Minnesota that hold ambulance license, and they would all be eligible under this uh, distribution formula. And in fact, if you look at the runs that we provided, you can kind of walk through there and see the six that have their own license that would become eligible. They're certainly eligible to apply for the aid and receive the aid. And again, they, like any other license holder, would follow that same formula. And you should be able to find that information on the run itself. And if any of them have questions, if you want to dive deeper into that, feel free to let me know afterwards. And we can kind of walk through that, but there are six of them in total.
All right. Any other questions for the Q&A? Otherwise, like Eric said, definitely you can be in touch with us, or we've also provided Dylan Ferguson's contact info. From Brad Hansen, if Centricare applies for the funds and I see the breakdown for our PSA areas, are the amounts only able to be used in that PSA? We do not separate finances for each base location and do our purchases for capital and operations from one budget that benefit all bases.
That's a good question. The way the bill is written, it only requires that the funds be spent in Minnesota. So while the primary service areas that make you eligible and generate the amount of money through the formula that you would in theory be entitled to, it only requires you to spend them within PSAs within the state of Minnesota.
All right, couple more questions here from Randy Strohmeyer. Can some of these funds be used to support operational reserve if we do not currently have sufficient financial reserves?
That is a really good question, and one that kind of came up as the bill was coming together in the final, I guess, even hours. And I think the legislative intent here is that the funds should be spent or encumbered by a certain period of time. So putting them into reserves for future use would not be an eligible use of this particular aid. But again, keep in mind, this was designed as kind of a one-time emergency aid to get money out the door and get money in your hands to do some things right now. And while we fully understand and recognize and appreciate that the problem that you're describing is real and tangible, that's not probably the purpose of this particular aid.
All right, and from Steve Robinson, why was Sanford excluded? They provide ambulance service in Worthington. Absent funding to keep their service viable may result in them discontinuing service, thereby falling on local government.
Another great question. It comes up, why did we exclude this one, include that one? Very good questions and very fair questions. Sanford indicated to us early on that just based on their entire book of business, that they wouldn't be wanting to apply for the aid anyway. So we didn't spend a lot of time trying to figure out how to make their at least rural Minnesota PSAs eligible. And we instead figured better off distributing that money elsewhere. But and that was the same for Mayo as well. I mean, they're definitely supportive of this concept and this idea, and supportive of rural healthcare in Minnesota and ambulance services. But both of those particular organizations indicated that they wouldn't apply for the aid anyway.
And I do think if I could just add to that, Steve, I think, there'll be probably in the ongoing discussion, there are circumstances where we do have these cross-border relationships and probably some attention needs to be given in terms of how to incorporate those. This was a combination of, again, what we were hearing from Sanford, as well as I think preferences from the folks in the legislature. Steve Nasby, if funds are used for capital purchases, such as a new ambulance, which spends all of the aid, can a city get the report done early and off our to-do list for 2026?
Yes. I mean, I think the process will be determined by the DOR and the EMSRB, but I would assume that answer would be yes. At least I would hope. Good government, right?
Yeah, I think, a lot will be determined here as the successor to the EMSRB and the Department of Revenue determine their own processes. And so, like Eric has said, there will certainly be a lot more information flowing out from many different sources on the particulars of this. From Betty Bergstrom, can funds be used to offset annual deficit?
So, I mean, it's a good question. I'm not sure that there's enough information there for me to really weigh in on this, but I would suggest that you look at the language in the bill. We know that the aid can be used for operational expenses and capital expenses, and both of those things are really detailed definitions within the bill. So if you look in the bill at the definition of what operational expenses are, those are the things that the funds can be used for. So I'm not sure that there's enough there for me to say yay or nay, but certainly happy to follow up with you afterwards too, and we can kind of walk through that.
All right. It's looking like we're kind of at the end of questions here. So we appreciate again, I think, all of your time and uh, interest. And again, this is going to be a very much ongoing discussion. And there's certainly more work to be done here in the next year. And we appreciate very much all of your partnership. And so with that, I think we'll wrap it. But again, please feel free to reach out to us individually with any other questions or issues that you might have. Thanks again for spending time with us this morning.